The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Natalie's heart operation and Sarah's double vision. Two-year-old Natalie was born with a malformed heart. Instead of two functioning pumping chambers, her heart only has one, leaving her at risk of massive heart failure.
And her fingers are purple and toes are purple. Yeah.
Natalie must undergo high-risk surgery to repair her heart. Two previous surgeries have created scarring, and Natalie's heart may be stuck to the wall of her chest. Reopening Natalie's chest could result in fatal bleeding, but without the surgery, Natalie will not survive.
Well done.
Yeah, I'll go now. Okay.
Oh, she's faster. It's okay. Yeah. Okay, then just hold it first.
Almost done,
There's
baby.
Mommy.
Almost done.
Mommy.
Show you some Emma. Almost done, baby.
All done, boo?
Nice and tight, yeah?
I'm done now.
All done now. You are done now.
Mommy, there's something that's for her. That's the worst part of your day, darling.
1 year ago, 14-year-old Sarah Rampersad underwent massive brain surgery to treat devastating epilepsy. Doctors implanted over 100 electrodes into Sarah's brain to isolate areas causing epileptic seizures. Once the area was located, doctors removed that part of her brain. The surgery eliminated Sarah's seizures, but left her with double vision. Now, 1 year later, Sarah returns to the hospital in the hope that doctors can correct her vision.
Okay, and your chin goes on here, and your nose just barely touches there. Catch the dots that I point to, okay? Like this one. Good job, that's it. So now you can see Dr. Buns, is it great?
How's the double vision coming along?
Fine.
Is it still bothering you?
Sometimes.
Is the double vision mainly horizontal or is it lopsided a bit?
Well, your tie is here.
Mhm.
I'll see your tie over there.
Is it sort of even or is it one
Yeah,
tie
like
higher?
Like that.
Certainly with surgery we could make the eyes straighter, there's no doubt about that. But the actual fine-tuning has to be done by her brain in a sense to make the eyes work together.
I would prefer to have eye muscle surgery to get my eyes back better.
Is it
Okay.
a long process, or is it an in and out?
The surgery? Well, compared to what she had previously done, it's a very straightforward, simple process. The muscles are attached to the white of the eye on the outside of the eye, and we simply open the eye, turn it, and operate on the muscle. And it requires certain stitches that melt on their own after a month or so.
What do you mean by stitching?
My stitches are really, really tiny. Nothing's done on the skin of your eye, around your eye at all, on the lids.
Inside.
Where does the stitches go?
The stitches are in the corner of the white of your eye. Right in the
Yeah.
very corner, that's right.
Oh, okay.
Good question. Point of the operation, to take your eye from pointing to the side to the middle. And when your eyes are in the middle together, then your double vision will be changed a great deal. Hopefully it'll be gone, but I can't guarantee that it'll be gone. You might require some prisms to help you, or even possibly a further operation.
Natalie, how are you? Were you examining patients with your stethoscope?
She was.
Has she been well?
Yes.
Any illnesses, infections? Or...
She's been pretty good the last month.
All kinds of incisions, haven't you?
You tell me does good work.
She heals up very well. I think she's ready for the next stage of her treatment. This is a bigger step than the last one and a little bit more difficult on her. As you know, the previous surgery, the last operation, diverted the blood from the upper half of her body, diverting it into the lungs so it didn't go through the heart. Now the final step is to divert the blood from the lower half of her body into the same circuit. In effect, that all of the blood coming back from her body would not go to her heart, it would go directly into her lungs. The main risk that's different in repeat operations is that the heart tends to be stuck to the chest wall. It makes it more difficult and somewhat more hazardous to get control of her circulation.
And this is the best time?
Yes, there's not much to be gained in waiting longer. The operation's not going to get any easier or safer. And we start to lose things by her being blue for as long as she is. And so I think it is the right time.
All right then. It's gonna work, right?
I think it will. And I wish I could tell you not to worry about a thing, but you know, having been through this before, there's lots to worry about.
Grab right at the elbows, okay? So stand right in front of her. Yeah, and hold nice and tight at the elbows. It keeps her nice and straight, and it keeps her head up as well.
Okay.
So you keep looking right at Mom. So come right in front of her. Good girl. Stretch. I'm just gonna help you move this for a minute. There we go. That's
Okay.
it. Yep. We're all set. Are you ready? Still like a statue. Look right at Mommy. I'm just gonna make you giggle. Oh, good. You did so good. You're very brave.
Ready to go home?
Yeah.
Who's at home?
Daddy.
So are we all ready for the operation today? Yeah. Okay. I just want to review a little bit with you. As you know, the eyes are pointing outward, and the aim of the operation is to make them straight. After reviewing it with my staff, I think the better thing to do is to do one muscle here and one muscle here to allow the eyes to come inward like that. We would just be doing one here and one here.
Okay.
Okay. So we'll see you later. Okay.
Thanks.
Thank you. Bye-bye.
Bye.
All right. I thought it was just this one.
No,
That's what you just said. You changed it. It's both sides, both ends here.
Yeah, bilateral, which means both.
Yeah.
Okay. Unfortunately, I'm going to have to interrupt your game here because we're ready to go. All right then, Sarah. You breathe. Okay. Okay.
Bye, mijita.
Good.
See you later.
Yeah.
Okay.
Chantel, I'm your nurse this morning, okay? You don't remember me because last time I saw you, you were a baby. You're a big girl now, right?
The gown's a little bit big, eh?
Yeah. You'll be swimming in this one.
I'm lupus.
Okay.
Yep.
It's brown. It's supposed to take like chocolatey cherries or something like that. It doesn't.
No.
Kids don't like it. But
It helps.
it does help. It helps make them a little bit more relaxed and sleepy. And
All right, then.
I think that's it.
She's an adult, so you want this.
How come not laughing gases make you laugh? Make you
Well, you haven't had a crack at it.
You're just laughing already.
You know what we'll do if you like. Good girl. Okay.
Could I have the table up a bit, please? So we'll start with the left eye first, okay? Now, the left eye is the one in which we're going to not worry about the lid. It's just a question of the lateral rectus recession. So here we go. Eugene, would you be able to hold this, please? Thanks. Scissors and forceps. And there, we've hooked the muscle now. Not a problem. Okay? That isolates the muscle tendon. So there's a well-isolated lateral rectus muscle. Let's just look at the very tip where it connects to the globe. There we go. Okay, good. Okay, we're all set to cut the muscle from the globe now. I'm just going to go a little bit above that. Don't want to spread the muscle too much because it's it's not that wide. Take out the lid speculum. And we'll put this in here. Mouse out, please.
How are you?
She's very happy at the moment.
Yes, she had the little chocolate drink.
Daddy gonna carry you, okay, babe?
Oh my God. Oh, you are so heavy. Oh. All right.
We'll come to the door.
Okay.
Give mommy a kiss.
Give mommy a kiss.
Hi, baby. I love you.
All right. All right.
Look after her.
Oh, you will. All right. See you later, Mom. See you later, Dad.
Okay. Dr. Williams has allowed 6.5 hours for the procedure, so I'm afraid it's a long wait for you today. I'm sorry.
Power cut. Turn it up to 25, please. Wire cut again? There, a bit of a depth gauge to tell you where the other side of the sternum is.
Sarah might be happy she got away a patch after. So then she'll be seen long.
I hope she doesn't have to wear glasses with prisms.
That's what he was saying.
Everything's proceeding quite nicely here. We're just finishing recessing or weakening the pull of the right lateral rectus muscle on the side of the eyeball. You can see where the tissue has been entered and then brought up, and this will heal quite nicely. There we are. Excellent. Okay. Everything went very well, and what you're going to see when you see her eyes, you'll see some swelling and redness in the corner here and here, 2 on the right eye and 1 on the left eye. Okay. And right now we put some antibiotic cream in her eyes, so her eyes may be a little gooey.
Yeah.
Her eyes will be red. She may not be pleased about their appearance, and that's important.
Yes.
She'll be glad she doesn't have to wear a patch.
Yes,
no
Yeah,
patch.
she's happy about that. Yeah,
Yeah, no
yes.
patch for now at least.
What we've done so far is just dissect through the previous scar tissue from the other 2 operations. But we're now in the situation where we can put our tubes in and start the actual repair. We now have a tube in the artery coming out of the heart. And that's what we use to bring blood back from the pump. You could put us on now, please.
Okay. Going on, your venous line is open.
A5. So the white material is Gore-Tex. It's a synthetic polyurethane that is going to baffle the flow from the lower half of the body through this chamber of the heart without it pausing until it gets into the lung artery. You can see the baffle starting to take shape now that we've got the back wall filled in. 4 millimeter, please.
Thanks.
Sarah, your parents are here.
You can see me?
We just gave her a little bit of pain medication, so she'll stay here till 12:15 with us, okay? Other than that, she's doing really good. She says her eyes are a little blurry, but that's normal. It'll start to improve.
And have beautiful eyes.
I see.
See it straight now, right?
Yeah.
Right. No double?
No double. I'm looking at you too.
No double vision anymore?
No.
Good.
Usually I look to the side. No.
How many times did you look at your watch?
I can't even tell you. I'm gonna take my watch off because I can't stop looking at it. Looking at the door, looking at my watch, looking at the door.
You could rewarm the patient.
Yep. Coming off?
The heart-lung machine is off now. So the child's maintaining her own blood pressure. We're just in the process of closing the incision, and then she'll go back to the intensive care unit. At the moment, her blood pressures are good, rhythm is fine, so we're happy with progress at the moment.
Hello, Dr. Williams.
And thank you for coming.
Hi.
Her heart function at the moment is good. Her oxygen level is quite good.
Like what?
So, 95 or so.
Wow.
Is that?
Oh, that's terrific.
So you'll be able to see her shortly. She'll be in the intensive care unit. And it'll take about an hour to settle her. But the next day or two will be critical time. She'll need a lot of care during the first 48 hours particularly.
So far, so good.
So far, so good. Exactly.
How's that double vision coming along?
It's closer.
It's closer? A lot closer? Or a little bit closer?
Your ears are touching.
My ears are touching. Okay. Okay. Just look way over here. See what the healing's like. The healing takes a while. The redness takes a while to go away. Look way up high. That's good. And here. I was really hopeful when you woke up and you said you had no double vision. That was great.
I know, my mom said that
Yeah,
too.
that's right.
There, she didn't have the double vision.
Right. I think there's a little more work here to be done. Her eyes have rediverged a little bit. They've both, gone a little wall-eyed, but I think that we can improve this, but I need to let the healing come on. Okay, are you able to tolerate the double vision for 2 months? Does it bother you a lot? What do? Simply ignore the image, the second image?
Yes, look at the main object.
Uh-huh. You could cover the eye if it's confusing to you, or we could give you a pair of glasses with a prism in them. You prefer not that? Okay, but I think she's coping quite well with this. And we probably will have to do something a little more to get you better, and I think we can get you better.
Like
So I
what?
wouldn't give up hope. Pardon me?
Like what?
Like a little more surgery on your eye muscles.
Oh, okay.
And what do you think of that?
Are you disappointed?
No, I'd rather have more surgery than wear prisms. Those thick ass glasses. Those thick ass glasses, I don't want to wear those.
Although Sarah's double vision has been improved, she is willing to face another surgery.
No.
She is more determined than ever to get the best results possible and overcome one of the last consequences of her struggle with epilepsy.
okay.
Hold up all right?
Her fingers are a lot pinker.
Yeah, they're not perfect yet because her circulation is a little sluggish, but they'll be better.
So,
How's she doing if you took that out?
took the breathing tube out?
Yeah.
She's not ready for us to take the breathing tube out.
Oh, okay.
Ventilator's taking all the breathing for her.
Doctors must continue to closely monitor Natalie's low blood pressure. She must remain sedated and on a breathing tube until her condition stabilizes. The next 48 hours are critical for Natalie's survival. On the next episode of Life's Little Miracles, Bubba faces cancer, and Natalie's recovery continues.